Hello, Dr. Antoine again from the Minnesota Disc Institute. In this section, I'd like to briefly explain what stenosis is. Stenosis is a very common spine condition that can really have major implications. Very common symptoms of stenosis are, of course, back pain, neck pain, along with tingling, numbness, and weakness. And very simply, what stenosis is a big fancy word for narrowing. So that can happen in the spinal cord area. Now, this is a normal vertebra and disc and spinal cord, and you can't really see too well on this model, but we want to see a nice big open hole where the spinal cord is. Same concept here, where the nerves come out. The fancy word for that hole is called a foramen. And so when we have foraminal narrowing, if you have an MRI report, very commonly they'll talk about central canal narrowing or foraminal narrowing. And that can occur from two different things. First of all, that can occur when the disc squirts out, and that can either compress or narrow the spinal cord area. That can also compress or narrow the hole where the nerve comes out. Now, that type of stenosis, our program actually has a really fantastic track record at helping to improve by getting the disc to suck back in and to help it to heal. Now, when we look at an MRI, this is a nice example of stenosis, and we'll see in normal situation you see the spinal cord has no pressure on it, it's not narrowed at all. But in this situation where you can see that disc has squirted out, it has narrowed the spinal cord substantially. Now, if you look at the image right below this little video, you'll be able to see stenosis from a real patient that came into our office. So you can see how his spinal cord was really collapsed and compressed because his disc had herniated so badly. After our treatment plan, which took about 6 to 8 weeks, you can see how that disc had retracted. It looks much healthier, and of course the spinal canal is much wider than it used to be. So for that type of stenosis, our program has a really strong track record. Now, I'll also show you stenosis caused from arthritis and degeneration. And without going into a lot of detail, you can see how this particular anatomical model shows that the disc is basically completely gone. You can also see that the nerve is really collapsed and compressed on because of the arthritis. Unfortunately, that's not something that we can really help. More than likely, that's more of a surgical situation. In my experience, most patients have a combination of both. They have arthritis causing stenosis, and they have either a disc bulge or a disc herniation causing stenosis. And if you're really on this website, you're looking to avoid surgery if possible, and that's really our goal for you as well. And what I'd like you to do is call my staff at 952-500-8090. They'll set you up with a consultation where I can evaluate you, get your history, look at your MRI, and really give you my honest opinion whether or not I can help you. So I hope to see you soon. Thank you.